Hey y'all, Chad Robbins here with Robbins Plastic Surgery. This week's skinny is capsular contracture. What is it and what are the treatments? This is something we get asked commonly. It's not something we see as much as we used to, and I'll get into the reasons why that is. But let me just back up and give you a little anatomy lesson. And so this is a breast implant. When we put this implant in the human body, just like any implant, if it's a chin implant or if it's an artificial knee joint or any foreign material that gets put into the human body, your body's reaction to that is to form a layer of scar tissue around it. So in the form of a breast implant, which is roundish, almost round, your body creates a sphere of scar tissue around the implant. That's called the capsule. And that is a normal process, and that's a very important process for anybody who has breast implants. That capsule, in most cases, is not pathological. What does that mean? That just means it's a normal capsule. And everybody who has a breast implant has a capsule of some kind. We hope that it's a normal capsule. Capsular contracture is an abnormal capsule. And what happens in capsular contracture is that scar tissue that is surrounding the implant begins to either get thick or draw up. And so as that scar tissue thickens, it tightens up around the implant and can make the implant feel harder on that side. It can also displace the implant or move it out of position. And it can also create pain and discomfort in some cases. So just like a lot of things in medicine, there is a scale. There's the Baker scale for grading capsular contracture, and that's on a scale of 1, 2, 3, 4. 1 is a normal capsule. 2 is a little bit firm. 3 is firm and abnormal in shape, visibly so. And grade 4 is abnormal in shape, firm, and uncomfortable or tender. So, so we treat 3 and 4s for sure. Sometimes we treat 2s. 1 is normal, so we don't treat those. And we'll get into the various treatments. But let's talk about the causes of the scenarios where we tend to see capsular contracture. I think the main reason we don't see it as much as we used to is most people are using silicone implants, and most people, at least I hope they're doing this, are putting them in the submuscular position. That's where the implant goes in under the pec muscle. That's really important. If you do those two things, your risk of capsular contracture goes way down. There are, of course, some patient-controlled factors that can cause or put people at risk for capsular contracture. One of those we know is cigarette smoking. That's the most common one. Also, other things include radiation. If a woman's ever had radiation of her breast or her chest for any kind of cancer. Another scenario where we see it commonly is when people have had complications after breast implant surgery, like an infection or blood around the implant, diabetes, connective tissue disorders. All of these things can cause capsular contracture. So we want to try to minimize the risk factors. We want to make sure we're putting the implant in the submuscular position. That's really important. And then if you do have capsular contracture, what do you do about it? You need to make sure you see a board-certified plastic surgeon, somebody who sees and treats these problems commonly. And of course, if it's a grade 2, it may be that you just watch it over time. It depends on how much, how bad the contracture is with regards to the visibility of the breast, or the visibility of the contracture, and also, of course, if a patient has symptoms, meaning tenderness of pain, you definitely want to operate on that. Operations to treat capsular contracture involve either just opening the capsule or completely removing the capsule, and we do both of those depending on the severity of symptoms. So hope that answers your questions on that, and we look forward to seeing you soon.